Good afternoon, everybody. We are live, and I am so excited. I'm coming at you from my son's room, if you're wondering the funny color. But I'm so excited. We are just waiting for our special guest to come on and this going. Should be here in a second. Why don't you guys tell us where you're from in the meantime? Hello.
Hey, hey.
How are you?
Good. How about you? Happy Monday.
Thank you. Happy Monday to you. I'm so excited that we're able to do this. We've been talking about it for a while.
Right. I know. Finally.
So even though, you're like renowned in the TOTS world, why don't you go ahead and tell everyone who you are and your background and how you got into all this?
Sure. Yeah, I'll give the Cliff's Notes. So I'm Autumn Henning. I am a speech language pathologist, a certified orofacial myologist, and a board certified lactation consultant. I, like Dr. Gigi said, I've been in the tongue tie world for a while now, and created a course on it called TOTS Training. And so I speak and teach those courses, as well as other myofunctional lactation courses, things like that. And then I have a private practice in Greenville, South Carolina. So that's me in a nutshell. The way that I got into this work was really just kind of random. I mean, I guess I don't really believe it was random. I think it was like aligned and meant to be. But the senior therapist on the team that I was working with about, 12 years ago, had this baby that was having trouble, not gaining weight, was about to have a feeding tube placed. Not only could she not breastfeed, she couldn't bottle feed either. And so they were racking their brains, and I did a lot of research. There wasn't a ton out there. There wasn't like all these fabulous Instagram accounts at that time, or Dr. Gahari's blog, or Dr. Richard Baxter probably hadn't even graduated dental school at that time. So I did a lot of digging, and I figured out that this baby had a posterior tongue tie, and none of my colleagues knew what that was. I didn't know what that was, really. And so, once I had that case, and, I learned a lot along the way, and it just opened up the floodgates for me, and seeing a lot of people with orofacial dysfunction, whether it's feeding or speech or sleep disordered breathing or TMJ or whatever. So yeah, I see infants all the way up to people in their 60s now.
Wow, that's so cool. For me, I treat infants, and I think I want to talk a little bit about that, where, physical therapy and speech and orofacial myofunctional all kind of overlap, but they're also different in different ways, and why people would need different things. And I think it's important to educate the public to just better understand why you would need one over the other, or if it didn't matter if you could find one and not the other. But yeah, for me, I stop basically at around kids that are 6 months, because I feel like once they need to actually be eating, then it's not just a physical therapy of teaching them how to suck. There's so much more that the jaw and everything they need to be doing that I can't really give them that comprehensive treatment. So I will refer out. I have a feeding therapist on staff that I refer to now, which has been great. But a lot of these kids do need to go on to have other things and like formal myofunctional therapy.
Right. Yeah. And I wanted to say, just like, also, Dr. Gigi is kind of a rare gem. So not your average bear physical therapist knows as much about this or specializes in it. So to all the families out there, noticing signs and symptoms and looking for help, I would say, you just really have to find the person that's best trained in specializing in these issues. And in some places it is a PT, in some places it's a lactation consultant, in some places it's a OT or a speech therapist. It just depends, really. And while we do overlap, sometimes it's a not a or, but it's a both in many cases.
Right. And I actually think, I mean, I'm lucky because we're in like this big metropolitan area of New York and New Jersey, but there's a
Right.
lot. Yeah, you get them all the time too, of people who just don't have access to anyone. So, you know, the lucky ones have a choice between who they can go to. But again, those are really more the lucky ones and not necessarily the standard norm. So I always say find someone who knows something about tongue ties, and
Yeah.
then there they usually have a little tribe that they've found, and then they can point you into the right direction. But just assuming that a speech therapist or an oral facial myofunctional therapist or a lactation consultant knows about this could really steer you down the wrong path.
Right. Yep. It's the individual, not the profession.
Yeah, I mean, you're doing such a great job of educating, and I feel like there has to be some kind of like designation or something, you know, so that we can put that on and say, yes, we've learned and we know.
Right, right. Yeah. And on my website, I do have a directory. I mean, it's not a certification by any means because I'm not, in the business of validating and making sure people are doing the right things at the right time or whatever. But at least if they're on the TOTS training directory, at least that they have the information. Like they've heard about it, they've taken a course on it. What they do with it from there, we'll see.
Right. Well,
But
I know very few people that don't take this very passionately, right?
right.
You feel about that recently, and I was like, this is awesome.
Yeah, yeah. It's a really fun area of practice and yeah, I love it. I love it.
So, we touched on it briefly a minute ago, but I have had some like speech therapists that are in and around this area who have called me and said, because I'm doing the neuromuscular reeducation and the oral motor work, that I'm taking their clients away. And
Oh,
that, certainly it's not something typically, I guess, that a physical therapist would be doing, but
right,
I feel like given the proper education, there's no reason why we can't be doing it effectively. And then we add on the extra piece of the developmental therapy. So we're doing it in like developmentally appropriate positions, offering
right,
them that they should be having at that developmental stage. And because of that, I feel like our outcomes are so great.
right.
And so I guess that's what I want to talk to you about, because you and I have talked about this offline before, but there's no reason why, you can't be doing, that it's not that I'm overstepping my boundary and in any kind
Right.
of way. But it's
Yeah.
important, that it's comprehensive.
Just because it's not usual doesn't mean that it's wrong, right? And so, I think you've taken it upon yourself to like develop a specialty and go a step further than, a general physical therapist out there. And for anyone that is like saying that you're taking their patients, they're not concerned about the patient, they're concerned about themselves. Sadly, you know? And so that territorialness is not what families and patients need. It doesn't help anybody. If you were harming someone or, doing something illegal, then I mean, yeah, that certainly warrants a conversation. But that's not the case here. And so, I really do. I would rather, I think people get their allegiances to their own profession and what they think they can do and whatever. And the bottom line is like I've learned some of my most valuable pieces of therapy techniques from OTs, from PTs, from lactation consultants, from other professionals, and really it's bringing it all together. And I would much rather somebody, see a qualified, passionate PT in this space that, has done their homework and their training than a speech therapist that doesn't know, So I really believe it's not about the profession, it's about the individual and the training. And, as long as, you have the license and the training to do it, then go for it. And as long as you're helping someone, proof is in the pudding, and doesn't matter what anyone else says.
Thank you. Yeah, no, I think that's really valuable advice. And like you said, I mean, I feel the same way that, we grow because we're constantly learning, and we're learning from people maybe outside of our profession, but it enhances what we're doing. And yeah, I mean, just as you to be able to recognize, body tension or body tightness or a head preference or whatever the case is, and recognize a need for the physical therapy, I think it's very similar.
Yeah, and I think you can't really separate the two. Like, the body influences the mouth and the mouth influences the body. And so, I see a lot of questions like, oh, we're doing suck training. Well, have you done anything full body? No. Oh, we're doing the body work. Well, have you done anything oral motor suck training wise? No. And so it's integrating the two. And, that's why, in my area, there aren't really PTs or OTs really doing much of this type work per se. But I collaborate with them regularly for, the full body work and, the developmental therapy type stuff. And, I just believe not one person can do it all and do it well. It's really hard to do it all and do it well. So being open to collaborate and, knowing where to send patients and when to collaborate is important.
Absolutely. Absolutely. I want to read a comment. Let me scroll through and see if I can find it. Anyways, here it is. The dream team. Chris Santos said, this is a dream team. Because of Dr. Gigi, I got an appointment with Dr. Autumn's team, and it was the best thing for my baby, which I think it just, this full circle where, it's so important that we all work together, because patients are really, I mean, that's our desire, is to help everybody.
Yeah. And, it's cool, as rough as COVID was, I feel like, a lot of people didn't have access to therapies, and, you being like a light and a leader and an advocate here on social media has really helped a lot of people. And yeah, I think we've had a couple of people that, were in our area and found us because of all the work that you're doing, which is super cool.
It's great to have people around that we can, refer back and forth.
Yeah.
Lisa Palladino from Tongue Tie Experts podcast said it is a team approach, and it's so true. And she also suggested that you need to ask people what training they have, which is so important as well. Hopefully they have training from TOTS Chrysalis, because your course is amazing.
Well, thank you. Thank you. Yeah. Yeah. It's interesting. There wasn't much, there weren't really courses on it specifically before. And yeah, it's just grown immensely. And I love seeing that. And the ripple effects. And, you can definitely do your work in your own clinic, in your own community. But when you teach, now you've, hopefully impacted more professionals to go out and do their work in their communities. And yeah, you can just make a bigger impact that way.
You're inspiring me. You need to send the therapists that are down there by you to me for a week. We'll get them all doing the same stuff. If anybody has any questions, feel free to type them in the chat. I'm going to start scrolling through and we'll get to some of the questions. Allie Kaplan wrote, interdisciplinary collaboration is so important in this area, so thank you for leading by example. I think that's such a great...
It's so important, but it's a lot of times it's easier said than done, right? Like we're all busy and running ragged and, balancing businesses and patients and family life. And, the people that do collaborate go the extra mile, because I don't know about you, like I'm scarfing down my lunch and sending an email to the dentist or the whoever, or I'm on my way home, about to make dinner for my family. And, I'm on a call with the orthodontist or, whoever I'm collaborating with.
Yeah,
So it does take time and going the extra mile to make it work.
absolutely. I mean, it's definitely worth it. But you're right. We do run ragged some days, but it's like we just couldn't have it any other way.
Yeah. 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 Because it works. That's the thing. Like I always say, I can't do my job effectively without the other members of the team, and they can't do their job effectively without the part that I'm doing. So
That's right. And as well as I do that, the release alone is just one little piece of the puzzle. And I think that people are misinformed, which is why I started this Milk Matters page to begin with. And it kind of grew organically just based on the need for the information and the rise in that sense. So it's been, I think eye-opening for everyone else to realize that it's not a quick fix.
right. Yeah. Yeah. And it is one small part and it's a critical piece,
Oh, for
but
sure.
it is the smallest like time frame in the whole scheme of things. And yeah, and I always say doing a release without like pre-therapy and post-therapy and body work is kind of like playing the lottery. Like sometimes it is the magical unicorn quick fix, and sometimes it does happen that way, like very rare and few and far between. Um, so sometimes some people win the lottery, but most of the time it's just kind of a waste of time and money. Because it doesn't make things all fall into place.
Yeah. Yeah, I guess it does depend who you get first. But now, now that we've been educating the public, I feel like moms are so much more informed than they were. Even when I started this Instagram page like 3-4 years ago, they know that they have to do some other work.
Right.
And, from a therapy perspective, I think what fascinated me with this population is that these were kids that I was going to be seeing anyway,
Yeah.
like 10 months down the line when they weren't getting their milestones or there was other issues that were popping up. So now I feel like we can address them so much earlier. And then they never
Mm-hmm.
come see me. Now I get, oh, look, they walked early or they're doing this, they're crawling. And, you hear all these great stories of how they're stronger than their peers because of the core work that we do. And, they never actually end up needing the therapy that we were seeing for before. And I'm
Right.
for you guys in the speech world.
I'm sure. I'm sure. Yes. And yeah, getting in front of it is so valuable. And allowing patients to rise to their full potential and getting rid of some of those barriers early on can make such a huge difference.
Yeah. Yeah. And just educating parents too, like simple things or like myths that are online and just being able to, help steer them down the path and empower them to get the right information makes such a big difference.
Right. 100%. Yep.
So Alondri Tanaga wrote, do you know some therapists in the Milwaukee, Wisconsin area? So you go ahead and then I'll give my 2 cents too.
I'm sure I do. I taught up in that area in like 2019. So I'm sure I do. You're welcome to look at our directory. If you go over to my page on the Instagram and go to the link tree, there's a link for the directory and just put in Wisconsin. And yeah, it depends on what you're needing, but there will be PTs, OTs, chiropractors, therapists, dentists, whoever's taking the course in that area should be on there.
That's great. And I was going to say that I too have one of the highlights on my page is called Find Help, and all the different directories that I've compiled over the years, yours included, is there. So you can go through and click on all the different links and find someone. And if you can't, there's always like local Facebook groups. Not my number one choice, but as a last resort.
Yeah.
Trouble finding, moms are always the best, most knowledgeable. So check like a local Facebook group, ask around, or do a search within it, and I'm sure you'll come up with somebody. And then also, if you are having trouble, send us a DM and I can help you find somebody too. Let's see. I saw somebody ask a question before I dig into our archives. Where'd it go? She was asked, oh, here it is. So pre-logopedy is saying, is there evidence that post-frenectomy exercises are effective?
So I think that you have to differentiate like the active wound management type activities versus functional exercises. So exercises actually improve the function. The active wound management type stuff just helps to heal in the right direction. So I would just look at the literature as far as like, I mean, do suck exercises help babies breastfeed, right? It doesn't matter if it's related to the tongue tie or not, just in general, like the evidence for oral motor and stuff like that. I mean, I can tell you in my practice, yep, because we see improvement, parents see improvement, both subjectively and objectively as far as, you know, pain with nursing, staying on at the breast, having a deeper latch, transferring more. And, you know, it's just like anything, like if you don't apply some sort of task or exercise to it, they're just going to keep doing the same thing they've always done. So in order to change what we do, we have to do something else.
Exactly. Absolutely. Absolutely. All right, let me dig into some of these archives here. And it says, I am going to an ENT about a tongue tie for my 6-week-old. Should I look at a different specialist?
So I think before going to the ENT, I think, you know, depending on if it's breast or bottle feeding, I would recommend seeing lactation or a therapist that is trained in tongue ties to make sure that the issues that you're having are related to a restriction, number one. And number two, if they're trained in this area, they're probably going to have good networks and know who the local specialists are as far as that have good outcomes with tongue ties. So I would probably go that direction and get more information that you can go into an appointment, you know, more prepared and armed with. Again, there's this big battle of like ENT, pediatrician, pediatric dentist, like who should be doing these tongue tie releases. And really, it's the same thing. Whoever's trained and whoever really like gets the whole picture. So, you know, if your area, if it's an ENT that does a great job and understands the mechanics of the tongue and everything, and, you know, has taken extra training in the procedure, then great. If it's a dentist, then great. You know, it just depends.
Yeah, I know. I do feel like it's more about who has the training versus, you know, specific specialties.
Yeah.
All right, next question is what is the best therapy for a 6-month-old that doesn't seem to have feeding trouble but mouth breathes? So every time I post something about mouth breathing or oral rest posture, this inevitably comes up that feeding is going fine, but they mouth breathe.
Right. Yeah. So this is such a gray area because you almost have to find like a unicorn practitioner for this because, so, you know, if they were 7 years old, I would say a myofunctional therapist. But since they're 6 months, right?
Mm-hmm.
Yeah. So it would need to be probably a feeding therapist that has myofunctional training. Now, while you can't do myofunctional therapy on, you know, a 6-month-old per se, you can use some of the principles of it and apply it into oral motor and feeding therapy. The other thing I would say is if they're mouth breathing, we got to determine if it's just open mouth posture versus mouth breathing.
Mm-hmm.
So that would be, say that again.
I said there's a difference.
Yes, absolutely. And so, you know, determining if it's an airway issue or more like a low tone or, you know, something of that sort. And so figuring out the reason behind it is going to be key. Yeah. So, also, if it is mouth breathing and an airway issue, odds are they are having feeding issues. They may be compensating really well and like, they're not choking, their weight is fine, but they may be using their muscles differently to compensate for that airway issue. So that's what I'd recommend. See if you can find a feeding therapist that also has some myofunctional training, and yeah, get that assessment.
Great. Delete that. Oh my gosh, there's a lot of questions. Let's try to get to a couple more. I got my 2-month little one's tongue and lip ties released. Any regression signs to watch out for weeks, months ahead?
2-month-old?
Mm-hmm.
So 2 months is kind of like a critical time period. Just, if you're breastfeeding, it transitions over, the milk supply transitions over from hormone driven to more supply and demand. So you definitely want to be in doing suck training and having your body work and be in oral motor type therapy to make sure that the oral musculature is working appropriately to pull and transfer the milk. Because when it does switch over to supply and demand, we don't want your milk supply to drop. Unfortunately, in the States, this is also the time that a lot of moms have to go back to work. So transitioning, pumping schedules and things like that is important. Yeah, I would say, obviously just watch out for the milestones. I find, babies that have had tongue ties, even if they've been, taken care of and habilitated or through therapy and stuff, they tend to have more predisposition to some of the things later on. And definitely better to get it treated than not early on, but more than the general population that haven't had a history of ties. So just keep an eye out for things like mouth breathing, teeth grinding, difficulty transitioning to solid foods, developing the babbling and speech sounds appropriate times. Just keep an eye. I say it's more like watchful waiting.
Yeah, being informed of what the signs could be.
Right.
Somebody asked this question, and I'm sure you get it a lot. What are the long-term impact on speech if you don't revise a tie?
So there's not a ton of research on this, but I'll tell you my very favorite study. It's, I think it was 2011 or 13, I can't remember, but it's by Dolberg, Dollberg. And so they looked at 3 groups of kids. One group never had a tongue tie. The other group had a tongue tie, but it was treated when they were babies. And then the third group has a tongue tie, but it was never treated. And so they looked at them years down the road, and the patients that still had a tongue tie and it was never treated had more than double the speech errors of those that were treated. So I always tell families that, we don't have a crystal ball. I'm not going to tell you to do this to prevent speech issues because you can still have speech concerns, right? It's multifactorial. But our best research shows that they are more likely to have articulation errors, in fact, more than double the errors than if you addressed it early on.
Wow.
Yeah, pretty powerful. So, yeah. Like anything, I think it depends on what's going on with the child at that point, risk benefit to addressing it versus not. And, we support families we give them the information and empower them, and they make their own best decision.
That's right. And I think it's Dr. Zagi who says that research is about like 10 to 15 years behind, like what's actually happening in practice. And so us as therapists and him as a doctor are seeing, we don't always have the research because it hasn't come out yet, but we're trying to work on it.
Yeah, it's so interesting. I love it when a new study comes out and when we like read it and I'm like, well, duh. I already knew that like clinically, but it's nice to like see it in numbers and black and white and peer reviewed and all that is nice. It's helpful.
Yeah, to confirm what we're doing and what we're saying.
Yeah. Yeah.
And I actually think that that's how we're going to get the pediatricians and the other like naysayers to buy in, because that's how we're trained, right? Is to look at the literature and decide.
Right.
Okay. So it's all sort of in its not so much infancy, but still new, and the research, the good research, really is still coming out. Hopefully.
Yes. I hope in like 20 years this won't be controversial. It'll
Yeah,
just be, yeah.
that's what
To
I
me,
hope.
it's like it's common sense to me, like, but
Yeah, I know. When I was speaking with Dr. Thomas out in Washington, we
Washington.
said that we don't want to be retiring and still in this same spot where we're trying to convince people that tongue ties are not a fad.
Right. Right. Yeah. Yeah. I think the tides are turning slowly, but
Yeah,
yeah, just in the last, 5 years, the awareness has definitely increased for sure.
absolutely, absolutely. I agree. Let's see. This is a good one. When to expect an improvement in coordination and latch after revision? Do we?
So variable. That is so variable. I think I hate answers like this because I know people want like a number and a time in days or weeks or whatever. But unfortunately it just depends. It really depends on um, where they were at baseline. Were they failure to thrive and having trouble gaining weight and we have some ground to make up? Are they in therapy and doing body work? How's their healing pattern and are they a faster healer or a slower healer? Could there be any reattachment or scar tissue? So, I would say usually within that first week, we see some improvement. Controlling for, everything's going, well, we don't have any issues per se. Um, the degree in which it improves and how quickly. And, the last thing to improve, I find, is endurance. So, they get the skill, but being able to sustain it through a whole feeding or whatnot that takes time. So I would not get, I would hope to see some improvement by at least week 3 if you're doing all the body work and therapy and things like that.
Yeah.
Yeah. Would you agree?
Yeah, I just want to add that I think that we're a little bit skewed because we only see the kids that are having trouble, right? The kids
Right.
that have it and everything magically goes well, or they don't make it to their first appointment, that they never end up in our office. We see the kids and the moms that are really struggling to get this going, or oftentimes, I mean, I wish it wasn't as often as it happens, but some of these kids are so good at compensating, and then you release the tie, and then they can't figure out how to eat at all, and then everything falls apart. They can't eat like they were before because the compensation isn't working, but they don't know how to use their tongue, and so there's a lot of work that can be done. The beauty is, and I always say this, the younger that these kids are, they tend to learn quickly because you're not trying to reverse these patterns that have existed for years. And you work on the older kids, the adults, and I can only imagine that takes much longer to reverse those patterns just based on what I know. Neuroplasticity.
Right.
It's possible to change, but it takes a lot more practice and repetition to get
Yes.
those changes. But the younger babies definitely that don't have a lot of tension and tightness tend to respond the quickest. And then if there's other underlying issues that have to be resolved, that all plays into it.
Yep. 100% agree.
So, but there are kids, that I think it's going to be simple and it's not.
I know, and those are so frustrating. You think, oh, this is a slam dunk. This is an easy case, like straightforward, and it's a curveball. And, that's why they call it clinical practice, right? Um, and, sometimes you think, oh, this is going to be tough, and we're in it for the long haul, and, it comes together. So, I think there's factors that we haven't even identified that, impact the prognosis and outcomes.
Absolutely. It's so true. And I don't think I ever thought about that, but you're right. I mean, things are constantly evolving, and then maybe there's things we haven't even identified that are playing into this.
Yeah.
Let's see. I keep hearing about tongue tie releases reattaching. How can you tell to prevent another release?
How can you prevent another release?
Yeah, I guess that's what it is. They're worried about.
Yeah. So, a lot of what we do is some stretches, or we call them tongue lifts, and basically lifting the tongue to separate. When there's a release, there's a diamond, and we don't want the diamond to close in on itself. So lifting the tongue helps to separate that tissue and make sure that it's not folding in on itself. So that's a big thing to address, or limit the likelihood of reattachment. Another thing is managing discomfort. If you're in discomfort, you don't move your tongue, right? And the tongue lays together, and the more a wet, sticky wound lays together, the more it wants to grow together and contract. Reducing inflammation levels. So, whether that's through, and I guess we're talking babies here, lots of skin to skin, lots of breastfeeding, lots of nursing is huge for reducing inflammation, and keeping that tongue moving is key. So some of the functional exercises that we do helps. Also, the body work side of things, when your whole body is tense, that affects your tongue movement. And so addressing that side of things as well. So those are kind of the main things to prevent reattachment or limit the likelihood of it. Yeah, and you definitely want to get into those therapies and get all that set up beforehand.
Yeah. The only thing that I would add is that I have seen some kids that have reattachment, but we can still work on them functionally to get the baby doing what they need to be doing. So I think there's a big fear of reattachment, but there's a lot of people walking around with tongue ties, and just with some of those oral motor exercises, we can get the tongue, like you said, moving and strong in the ways that it needs to be. So I think that those functional exercises are really, really important to address before you go back and re-release. And I think that's my biggest frustration, is when kids have had 2 and 3 releases but never had any kind of therapy.
Yes.
And giving the tongue a chance, because each time it gets weaker and weaker.
Well, yes, exactly. And, I think people think like, okay, if things don't fall into place immediately after, then it didn't work. And really it's, a functional pattern that has to be trained and taught. And so, there are varying degrees of reattachment, and so really, yeah, definitely don't go back for another revision if things are functioning well, right? Like you can have some degree of reattachment, but if things are going well, no need to redo it, right? And that's part of the whole therapy part, is we kind of help decide if that structure, that reattachment piece, is affecting them enough to go down the surgical route again. And I always say, what is that saying? Repeating the same thing over and over and expecting a different outcome is what the definition of insanity.
Yeah, I like that.
And so if you do end up having to do another procedure, you want to do something a little different. Like we need to figure out the factors that contributed to the reattachment and switch things up so that we're not repeating the same thing again.
Yeah, absolutely. I think it's a great point. So there are still a ton of questions, but I am going to encourage you guys to either send a message or give you a call if you're in that area. Why don't you let people know how to find you?
Sure. Yeah. So you can find me on Instagram, just Chrysalis Orofacial 1. You'll see that here. Will you save this too so people can watch it back? Okay, perfect. Yeah. That's a great way to get a hold of me, and I can help you find someone in your area or give you, an answer to your question if we didn't get to it. Any professionals watching, you can find all our courses over there as well. But yeah, we'd love to see you at a course or, help you go in the right direction with your child or yourself as a patient. So.
Thank you, Autumn. It's been an absolute pleasure. Thank you for your expertise, and you're just so sweet and lovable.
Oh, thank you, Dr. Gigi. You're a sweet support, and yeah, I love your spirit, and your Instagram page is phenomenal. So keep up the good work, and I'm sure we'll be seeing each other more.
That's right. All right. Thank you so much for coming on, and everyone have a lovely afternoon. And I will be saving this, so no worries.
All right. See ya.
Take care now. Bye-bye.